Um,
Hello, everyone. This is Lark,
and Kimberly.
and this is auto asphyxiation. Today, we're talking about the caretaker city. We actually kind of read an article, a 2023 article, The Urban Infrastructure of Care Planning for Equitable Social Reproduction in America. And it was in the American Planning Journal it was written by Binet et al. So a whole bunch of other people, Binet and a whole bunch of other people. um, just so I can just go into what social reproduction is, because we talk about this a lot in the political economy or socialist Marxist world. We talk about social reproduction a lot. And social reproduction describes the reproduction of social structures and systems mainly on the basis of particular preconditions of demographics, education, inheritance of material property or legal titles. Reproduction is understood as the maintenance and continuation of existence of social relation. And within like Marxism, social reproduction includes the care and socialization of children and care of the elderly or infirm. Social reproduction includes the organization of sexuality, biological reproduction, and how food and clothing and shelter are made and available. So, for like a short summary, it's about how power dictates categories and reproduces oppression. That's a short answer. So I'm gonna like read a quote and then we're gonna get into it. It says, Nina says, I'm on the run at all times, said Nina, who cares for her three children and her elderly mother in a rapidly developing neighborhood of Boston, Massachusetts. I want to slow down, but not with the cost of living. I can't. I just can't. I want to go to the gym, but I can't. I want to go home, but I can't. I just can't. It's just so big. So it's kind of like, and a lot of people probably like, oh, she can't go to the gym. Who cares? That's like very like bourgeoisie, whatever, et cetera, et cetera. But the thing is that being able to go to the gym, being able to like have time for yourself, as a woman, that should be, I mean, as a human being, that should be something that everyone could have. Just because you're a parent doesn't seem like you should not be able to do that. And it seems like cities are kind of created to reproduce oppression, which is weird because I think about your time in the Bronx, Kimberly, your family's time in the Bronx, and how it was such about having community and having help and all these things in regards to the Bronx, in regards to the city, but that seems to have gone away. What are your thoughts on this, Kimberly?
it definitely seems to have gone away. And one of the things that I noticed while reading that article was it was so very clinical. It read like a medical journal, which is something that I'm more used to. And it seemed really removed, other than a few quotes here or there. It seemed really removed from the humans and the humanity that it was really trying to capture. And I realized like that urbanism's focus is urbanism, is the city and everything like that, but it still comes across like a Lego plan, very much talking about the function and the structure of the city and not so much talking about or really embedding yourself with the people that live in the city and work in the city and have to get around to live their lives.
Yeah, I think that's really interesting. And it's like weird. It's like even people who are trying to be like, we're trying to reach the people, they're not really reaching the people. They're still talking about it in this very kind of clinical way. And it shows why in the United States, it's very weird. You don't really have a mini, essentially, we are the only editorial media project that talks about feminist urbanism in the United States. I know that sounds like, wow, that's amazing. So you're the only one? Yes, we're literally the only feminist urbanist media project in the United States because of this kind of idea that I'm not really sure. Well, because of capitalism and because of the idea of the homemaker doesn't have a real job. Urbanism focuses a lot on people who work outside the home. And so people who are homemakers or primary caregivers, or even people who work at home and then have the second or work outside the home and have a second shift, those people aren't really thought about in a real way. And they're also, it's weird, it's also kind of thought about as like, oh, it's just poor people, not realizing that it's pretty much 80% of women. It's not just poor women, it's poor women, it's working women or working class women. And in the United States, we have this thing called middle class. So it's middle class women, it's upper middle class women who have this second shift that makes it so that, you are, the urbanism is not necessarily working for you. I think about so many men who are in urbanism who are like, I hate cars. I hate all these things. We should have more bike lanes. We should have more trains. And literally every single one of their partners have a car because they have to. They
Yeah.
have to. If they have a little baby, if they have a child that's under the age of 16, they essentially the primary caregiver of these children and of these teenagers and of seniors has to have a car. And I think that says something about what we really care about and what we don't care about.
Well, and I think that it overlooks the fact that the heart of families and communities are caregivers. They're your moms, your grandmothers, your nurses that live in your neighborhood, your home health aides that live in your neighborhood. Those are the primary caregivers in your social community. Um, it's I lost my train of thought again. Um, but I think that in order to really understand how people function in a city, I think that some of these urban planners need to actually embed themselves in communities where there's a high population of women caregivers or caregivers in general, high populations of women that work second and third shifts and have to rely on public transportation, women that have to rely on public transportation to get their kids from school to after school programs to sports, etc. I don't think that they're actually they're looking at it. And the article that you sent me they used 45 resident people to go out and to ask questions to get the answers for them, but the people themselves are not embedding themselves in these communities to see how they actually live, work, and function. They're only looking at it from afar.
Yeah, I think about a lot in regards to that kind of research. I think about it's a qualitative research, and think about Denson. He's a researcher that kind of he becomes part of the research. I think that there is a challenge in regards to, and I even think about it in urbanism myself. I'm often asked to do things in regards to urbanism, to be a representative, to speak for women. And I often kind of go, no, I can't do that because I don't have children. I have a cat. And I feel that my ideas it isn't fair for me to give my impression of what is going on in our cities when the fact that I am almost kind of like an outlier in regards to how I live my life. I've always lived my life as a kind of an artist, bohemian type, and I've, actively not have children. So it's kind of like, to even ask me, to in regards to this, to caregivers is not necessarily, I don't think necessarily fair. Because I mean, the thing is that I can ask questions all I want to, but what in some ways, what does a 15-minute care map look like? Because I think about in some countries, they have these 15-minute care maps. Okay, that's what they said. They said that's we were reading articles and we said that's what we kind of ran into this. Okay, if you had childcare, if you had, food, if you had, like groceries, you had public transit, and you had schools all within a 15-minute walk from your home. And I'm kind of like, why can't New Jersey have that? New Jersey is really, I'm thinking, isn't the whole point of New Jersey to have kids and be married? Is that the whole point of it?
And well, people move here from the city to, like, raise a family. Like, this is like the place that you come to when you are ready to settle down and buy a house and have a family. When you're talking about like a 15-minute city, I remember when I lived with my dad in West Milford before I went to college. West Milford is also a very rural area. They had a town bus service, and the town bus service was $1. And it was just an old school bus that they like repainted and put West Milford Town bus service on it. And it went to all of the shopping centers in town and the senior centers. And it had strategic stops that were places that were easily walkable for people that might need that service. I was a person that used that service. I was on there with a whole bunch of senior citizens going to the senior center for the day. But I used that service to get to my little convenience store job that was too far for me to walk. Um, so I think that a 15-minute city can be walkable. And I think it can also be, if it's slightly more spaced out, a simple bus service like that is inexpensive, and very easily accessible for people that are riding it. Like $1 a bus, it's still $1 a bus ride. And the last time I took that bus was probably 1998, and it's still $1 a bus ride. And this still the same old man drives it, and he he will let you smoke on the bus if you like.
That's a if you letting you smoke on the bus. That's a added bonus. I think about they were talking about this bus. I think it was in Brompton, Ontario. They're always like, oh, the only great, bus in suburban America or suburban North America. And it's like Ontario, and it's like Brampton, Ontario. And I'm like, oh, okay. You're like, yeah, so many people ride this bus. It's really popular, et cetera, et cetera. I think one of the challenges here in the United States is that they want the bus to be horrible. Like they actively say they make the bus as horrible as they can make it so that people are like, you know what? When I get anything going for me, I'm getting a car because this is absolutely horrible. And I wonder what we can do to make, here's the thing. You might not be able to add a train immediately, but you could add a bus. Like
You could add additional bus services that are outside 9 to 5 hours. Yeah, there's definitely, I definitely feel like they make the bus seem like it is like the lowest class option that you could possibly ever take. And it's like they make it feel like it's almost shameful to take the bus. And it's not. Like the bus is absolutely fine. We all went to school on the bus and it was okay. The New Jersey transit buses, they just need to be a little bit cleaner, and they need more stops and more routes so that they can be accessible for everybody.
and they're I think interesting about New Jersey is that when I got on the bus in New Jersey, I was surprised at how crowded it was. It was the middle of the day. What happened was that my car had broken down, and I don't know what I did. I think I hit something. I think I hit something or something like that. I don't know. I'm a bad driver. That's why I take the bus, and that's why I take the train and ride my bike. Anyway, but for some reason ended up taking the bus, and it was in the middle of the day, and it was crowded. It was like standing room only on New Jersey Transit. I was like, why isn't there more buses? There are people on this bus. People are taking the bus. It's not like people weren't taking it. So, and also too, I feel like they're, it was kind of shocking. But another thing I'm kind of like going to bring up is that when I go around New Jersey, I don't see a lot of children oriented stuff. And I also see a lot of kids. Okay, I go to bars, and when I'm at bars at lunchtime, I see children in there, children with their parents. And the thing is that it doesn't look like a mom that's like, or because always their mom they're with. It doesn't like a mom that's irresponsible. I'm not even like this is not like, oh, well, she shouldn't be in the bar. I'm thinking this person looks like the way my mom would look. My mom was a housewife. and they just have no other options. They have no other option if they want to eat healthy food, because McDonald's is not healthy, Burger King is not healthy. If you want to eat healthy food, you're going to have to go to like one of these like bar/restaurant places, and there's nowhere for people who are caregivers to take their children. I see, like, it was so weird. I was in Jersey City and I was at this really cool restaurant, and it was clearly an adult restaurant, and this mom brought her children in and they were screaming. They're like, ah! And I was kind of like in my head, and she's like, I'm so sorry. I'm so sorry. And I was just like in my head, why aren't there restaurants or things for people who have children to go to? Why is it that the option either you go to McDonald's or you go to a bar where there's people doing like work business, like, and it's like the kids are like, this isn't fun. So I mean, I'm kind of surprised. I would think there'd be, I go to park, I see the parks, they're empty. The parks are empty. The open space is empty, even on sunny days. And I'm just kind of wondering what is going on. And I've heard in regards to like parks and things, they're like, well, if I go to this park, I got to walk up this hill when I have a stroller and I got to do all this stuff. It's not really walkable, et cetera, et cetera. Like apparently like people who are primary caregivers don't want to go to parks that they have to like drive to or like go up hills to. But I don't think parks are made that way. I think people aren't even thinking that when they make parks.
No, I think because parks are usually try to emulate the natural landscape as much as possible. So, like, if there's a hill in the natural landscape, there's going to be a hill in the park. But I think you're absolutely right. And there's a person that I watch on TikTok. Her name is Park Rose Permaculture. I don't want to get her name wrong, but she talks a lot about how children are the most oppressed class of citizen in the world, and that uh, especially in the United States, that public spaces are often hostile to children unless it's in a specific area. We have things like, she used an example of like a play park, right? Like where there's structures that children can climb on. And then you take children around a building in a city, and there are sculptures that look very similar to play structures, and kids aren't allowed to climb on it, and they get yelled at and told not to do this. And they really have taken away like family oriented restaurants. Like I remember as a little kid going to a place called Ground Round, and the floor was entirely covered with popcorn, because as soon as you went in there, you got a big old basket and you could get popcorn, and there was just popcorn everywhere. There was that place. There was Fuddruckers. That was like a hamburger place that was very family oriented. They had like arcades and games and things like that. And those places really have gone away. My parents used to take me to a bar, and it shocks me that parents still take their kids to bars. Like, but I also, I think the bars are probably a little different. Like the bar that my parents took me to was an actual bar with like sawdust on the floor, and I used to scam quarters off of the bartender so I could play pool and put songs on the jukebox. But like I think that it's part of it is also lack of caregiving in Gen X and in millennials, like for their children. Boomers are not taking care of their grandchildren much in the same way that their parents did. Like the greatest generation parents were around to care for their grandchildren. My grandmother, I lived on the first floor in the Bronx. She lived on the sixth floor, and they moved to New Jersey with us. And boomer parents don't want anything to do with their Gen X and millennial grandchildren. Like they're like, no, 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 we're retired now. You all are grown up. It's our turn to travel and to live our lives. And I think that's a large reason of why Gen X and millennial parents don't have a lot of caregiving around them.
I didn't really think about that. Yes, this whole like, you have this generation of people who are helping you. It's kind of like, you can't do it by yourself. This whole idea of like this mother, even here's the thing, even if you are like married and you are a caregiver, it's kind of like, oh, well, that's good enough. Well, literally, no, you actually need more people than just you. Even if you don't work outside the home, you still need help. And I think in a way that this is a tricky way of trapping primary caregivers in the house. Like
I,
they don't want them to leave. Like, no, yeah, we're making it hard for you because we don't want you leaving. We want you to stay put.
I think you're absolutely right. And I think that if we look back at the last 40 years, there has been an insidious patriarchal expansion through Christian right organizations like the Heritage Foundation, Focus on the Family, um, anything that Rush Limbaugh pushed in the 80s and 90s. Now we see a lot of things pushing like trad wives and this whole wellness thing. And, like a lot of the self care stuff is very like kind of patriarchal and you should stay home and be ultra feminine. So it doesn't really surprise me that there's no resources for young moms out there. Like there's really a push to just be a stay-at-home mom and to kind of do as you are told by your husband and everything is on you.
I mean, and I think about women who do not have partners, like who are like I hate using the term single mother. I use the term unpartnered parent because it's like, well, why are you getting the label? Like they don't call people like if you're a dad, they don't take care of your kid. They don't call you single dad. I mean, they if unless you have the kids with you. But if you're a mother, it's like, oh, single mother. I'm like, no, you're just an unpartnered parent. And so I'm like, you know, a lot of these I remember I was having a conversation with a bus driver and I asked her, and this was in downtown LA. She was like, I was like, why don't you live in downtown LA? This is when I was younger. And she looked at me and she was like, do you know how much the rent is? I have two kids. Do you know how much the rent is in downtown LA? And I was like, well, you work for MTA. You're a union, so you should probably have a good job, right? And I didn't say it in like in a jerk way. I was like really serious. I thought that she was just like, brainwashed by suburbia. And she just wanted to live in suburbia and didn't want to live in downtown. She's like, first off, we start off as part time. The MTA, they don't in Metro in Los Angeles, they don't start you off full time. You start off part time. If you work out, they let you do full time. And she says another thing. I was like, even if I did work full time, I can't afford to live here. She said the rents here start at like $2,000, and she says I can't do that because childcare alone is like $1,000, and the rent's $2,000. Like, how much do you think I'm making? She was really nice to me about it because I was like, very like, well, you could just move to downtown LA and it would be easy for you. And here's the thing, I feel like, wow, we should have policies. It's kind of like I think about, Trump and all of them. They're like, well, we want them to have children. Well, how about we do things like essentially, I mean, create affirmative action for primary caregivers, whether it be you're taking care of children or taking care of your parents. So you can live in areas that have public transit, that have jobs, that have so why can't people who are primary caregivers, why can't they live in Manhattan? Why can't they live in downtown LA? Why can't they live in like downtown Chicago? I'm not really sure what that would call it. Why can't they live in Madison? Why are they living in the outskirts? Because that's what they can afford. They have to do this drive to they qualify thing. And maybe we should have policies that, oh, if you are a primary caregiver, whether you're taking care of a 90-year-old or a 9-year-old, you get priority in regards to housing. I mean, I think that we're not even thinking about that. We just kind of feel like if you're not married, we should punish you. If
Yeah.
you're not married, we should punish you. You're a bad girl. And if you are married, well, your husband should be taking care of all of that. So you don't even need, I mean, here's the thing I think about in regards to, I don't know if you have this issue, but I think about in regards to myself, in regards to trying to get get employment. The people view, if you're married, they just think, well, you don't need a job. You have a husband.
Oh, absolutely, absolutely, absolutely. Yeah, no, it is very much like so like, like if you try to pick up hours or something like that and like, like other people are fighting over them. It's like, well, what do you need a job? Like you have a husband, right? Doesn't your husband make good money? It's like, yes. So, like
it's really hard because it's like in a situation, like if you're in an abusive relationship, I'm not in an abusive relationship, but if you're in an abusive relationship, if you are married, you literally are, you cannot leave. Because you cannot, if they know that you are married, you will not be able to get a job, which is wild to me.
It is. I mean, like I work in a mostly like female centric line of work. So finding jobs for me is not terribly difficult, even though I am married. But yeah, there always is questions like, if you want more hours or if you're asking for better pay or a raise or things like that. It's always, like they always expect that, well, why do you need it? Like so and so doesn't have a husband.
Well, yeah, and this is like in no way trying to be like, oh, tiny violence for us. I'm not saying that, but I'm just saying this kind of like these choices that we have is kind of like people who are primary caregivers, people who are not men, the situations that they're put in. And even like things such as simple as like I think about, wow, wouldn't it be great if all of these children were able to have bike lanes to their house? So that way it's like we wouldn't have to do this whole drop off thing. I think one of the nightmares that I see in regards to primary caregivers is the drop off to school. I'm like, what is this nightmare like that you got to do? And here's the thing: typically, like by my house, it's literally a walk. It's walkable, but because the street is so fast, it's kind of scary to let a kindergartner walk to school. But a kindergartner could walk to school if we had a bike lane, if we had some kind of like policy. Wow, when we're within 2 miles of a school, you have to have 15 mile per hour I guess traffic, and in a bike lane or something like that so people can get to school. I think that would do a lot to alleviate, think about if you're a primary caregiver and you could tell your kindergartner just ride your bike to school, like what or first grader or second grader, just go to school, get on their bike and ride to school. And as you knew, you were secure that they were going to be safe, like in Japan, like how kids go to school by themselves.
Yeah.
I mean,
I walked to school like when we moved to New Jersey, I walked to school. My elementary school was less than a mile away and I walked there until I graduated. I rode my bike when I could ride my bike and because my parents wouldn't let me learn how to ride a bike in the Bronx. um, but it was imminently possible. And there were lots of little kids. And I think of also, because I've seen it also in more rural areas, I think part of it is not just that there's a little bit of unsafety for children amongst cars and traffic and things like that. I think also that it is that like helicopter parenting that came with the millennial generation. Like this last time when I lived in Oxford, and I left there in 2017, I was on my way to work one morning and somebody was driving down their driveway to sit at the end of the driveway with their child until the bus came. The driveway was maybe 50 feet. And mom could stand clearly at the driveway and see the bottom of the driveway where the kid would wait for the bus. And this was not on a busy street. There were no neighbors. Like it was really in the woods. And I looked at that and I was like, that's a little ridiculous. Like, I understand you want your child to be safe. I understand that people are protective of their children. But also, at some point in time, when your children start to get old enough and start to exert their own independence, you have to trust that the lessons that you've instilled in your child are effective and your child will know what to do. And when your kid is 50 feet away down their driveway, standing at the mailbox waiting for their bus, and this kid was also like 9 or 10, so it wasn't a little kid. That's a good age for them to start being independent with certain things. So like I feel like it's a little bit of society, but also like that helicopter parenting that like is not leaving kids to exert some of their own independence when they are gaining it.
Trust me, I was in, what did I do? I forgot. It's this place. Gosh, I wish I remember the name of the place. Anyway, I had a friend and I dropped his kid off to school. And I said, and the kid was in high school. And I said, do you want me to drop you off, you know, around the block? So that I wouldn't drop you off because, I'm from Los Angeles, from Hollywood, California. That's not cool having your parents drop you off and you're in high school. And he was like, oh no, you can't do that. This isn't high school. He says, it's not allowed. You have to drop me off at the front. I was like, what? I was like, you can't just walk into school? No, that's not allowed. I was like, but you're in high school. So this is in New Jersey. I was
That's
like, you have to be dropped off by an adult to school?
that is crazy.
Oh yeah, Basking Ridge. I was like, that's where it was. And I think I was in shock. I was like, what? Okay, fine. But I just dropped him off. But in my own head, I was like, that is wild. That is so freaking wild to me.
That
Um,
is wild. That's taking away independence at a time when children should be learning their independence and learning to trust their own selves and the parents that their lessons have taught them.
yeah, I mean, that was just, I mean, and I think that all this fear thing, and I think about, because we're talking about like, sexism and all this stuff. And I think about like how like racism kind of played into all this stuff, kind of like, oh, we have to keep things segregated in regards to not just, to race, in regards to gender, in regards to like, play like in regards to business life versus personal life, all of these things. And who does all of this stuff benefit? Who does this segregation benefit? It doesn't benefit, you know, because this fear, like, what if some gang member, which is like code for like Black or Latino, what if some gang member comes and attacks your kid or attacks your wife or whatever? You can't leave the house, you can't drive around, you can't walk because only men can do that. Even like I feel like when I'm kind of like in the whole urbanism environment, it's like very a man thing, like oh, we are have freedom to walk around, but you don't have freedom because their wives, like a lot of these people who are in urbanism, I'm always shocked at how I don't see their partners, their women partners that are part of their life. They're not part of all this stuff. They're not part. It's like this is their hobby. Like here's the thing for me, I force everybody. No, sorry, I shouldn't say it that way. I encourage everyone that I'm with to also embrace the same ideas that I have. I couldn't be with somebody who's just like, well, I'm not, I'm going to be driving around everywhere. I don't believe in what you're doing. If you know what I mean? I would expect you to do that too. And I think that in a way, there's this, it's very strange that even within urbanism, there's this sexist, a little racist, not a little, maybe a lot racist subcurrent that's kind of going, I don't even know if that's a word, subcurrent that's going through that's allowing this conversation to not happen in a real way, where instead of getting like feminist urbanism, we're getting things like, look, a bus is pink. We have a Jane Jacobs walk. Like that's
Oh,
it.
look at that. It's got a pink ribbon for breast cancer month. All the women should be happy now.
Exactly. Like that's not feminist urbanism. I mean, it's weird because like, in Europe and Asia, in all like there's a thing kind of like where there's actually policy behind it. But for us, it seems like that's not there. And also it hurts caregivers, and it hurts our ability to advocate for things because it's kind of like, I think about some people who are, whether they're disabled or they're seniors or they're primary caregivers, they're like, well, I can't ride my bike there. I can't walk to this place. And it's like, because we're not building things for people who are not able-bodied 35-year-old men.
Yeah, you're absolutely right. And I'm willing to bet you that these urbanist men are not even speaking to their wives about like their ideas. Like they're not even talking to them like, oh, hey, I was at this conference and this came up and like, what do you think of this? I'm willing to bet they're not even having those conversations with their wives. And that's why they're not informed by any sort of actual feminism when they're making all of these plans.
Yeah, I always in my own head, I'm like, why isn't your wife taking part in this? I mean, and I don't feel like being like, I'm not trying to be horrible when I'm doing that, but in my head, I'm like, if this is your such a huge part of your life and you're married and you have children, why are they segregated from this? If this is what you believe in, if you can't even convince the person you're sleeping with in regards to urbanism, in regards to like changing how we live our life, how are you going to convince the public if you can't even convince the person you had an actual another human being with to engage in what you're into, you know? And I'm not trying to be like, I'm really not trying to be mean or horrible or cruel, but it doesn't make any sense to me.
No, but you're absolutely right. And there's so many aspects of life that they don't take into consideration with urban planning. Like you mentioned the disabled, and cities are built for able-bodied people, and they're not thinking of the fact that we think of the disabled as a small minority of people, but guess what? Everybody becomes disabled if you live long enough. So why aren't you planning cities for disabled people? Because we are all going to be disabled if we are fortunate enough to live that long.
Exactly. I mean, I think that's, I think something we should remember, like, in regards to not just, a caregiving city, it's not just about caregivers, it's about caring about the people who live in your city and caring about those who would be, who need the most. Like what if you live to be 105 years old and you had a little walker, what would you need to live in Manhattan? Like design the city for that guy or that woman. And I think that we would have a better city for everybody if we designed it with that in mind. Like, oh, if you're 105 and you had a walker, what would you need in order to get around Manhattan? Um, Subways,
Exactly.
yeah, even even like bike lanes. Like, what kind of bike would you need? What would we need, and how can we plan for that? And with that, we're gonna wrap it up. Is there anything else that you would like to say?
I think, I think that mostly like New Jersey definitely needs to expand their rail, both light and heavy. Um, they need to be beyond commuter focused, and situate schedules so that they can have more off hours transport for actual people that use their services, because not everybody is a 9 to 5 white man going into Manhattan on Wall Street.
Yeah, you that seems like it's really simple, but it's like, yeah, can New Jersey Transit, and SEPTA, there are people that use your train and your bus hours between 9 and 5 just to go shopping, just to take the baby or to take mom to her doctor's appointment. And we should take those people into to account. Like, you shouldn't have to drive. Like the fact that my mother in her 70s, she was never a good driver. Even like when we were kids, she was never a good driver. It's still driving. It's quite frankly terrifying to me. And I would love it if we had other options for people, if they want to be independent. That is not them driving their late model huge car when they can barely see.
They're land yachts.
Yeah, yeah, they are. They're like driving around like this little old lady. I shouldn't say that. My mom would be mad. This woman who is in her 70s. She is not a little old lady. She is a person, and she is driving her car. And I don't want her driving anymore. And she's getting me mad about that, but I don't want her driving anymore. Anyway, all right. With that, we will bid you adieu, from auto asphyxiation. So you have a great evening.
Thanks for listening.
Yeah.